Welcome to this week's edition of Ask an MS Expert. I'm Jon Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I'm a member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. I'd like to acknowledge and thank today's premier national sponsor, EMD Serono. Support from MS community partners helps the National MS Society reach its goal of providing up-to-date information and support through programs like Ask an MS Expert. Thank you to all of you who are joining us today on GoToWebinar, Facebook Live, YouTube Live, and Twitch. The MS Society's Ask an MS Expert webcast is designed to connect you with the MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. So as I chat with our expert today, please feel free to post your questions in the GoToWebinar chat box. We'll try to answer as many of your questions as we can during the Q&A portion of today's program. And the Society's MS navigators are also online throughout today's program, answering questions and connecting you with resources. May is Mental Health Awareness Month, and this month's Ask an MS Experts programs are all focused on cognitive, emotional, and mental health. MS can cause cognitive changes, including problems with memory, attention, and concentration, thought processing speeds, and other symptoms that can impact your quality of life. Dr. Ruchika Prakash is joining us today to help us understand how mind-body interventions like mindfulness meditation can improve cognitive health in people living with MS. Dr. Prakash is an associate professor in the Department of Psychology at The Ohio State University and the director for the Center for Cognitive and Behavioral Brain Imaging. She's a licensed clinical psychologist who's been doing research on lifestyle interventions in people with MS for the last 15 years. Dr. Prakash is also the advisor for the Clinical Neuroscience Lab, where she works to better understand how physical activity training and mindfulness meditation help to improve cognition, reduce depression and anxiety, and impact brain plasticity in individuals with MS. And she's a member of the National MS Society's Psychosocial Wellness Group. Dr. Prakash has published over 75 peer-reviewed journal articles, and her research is funded by the National Multiple Sclerosis Society and the National Institutes of Health. Welcome, Dr. Prakash, and thank you for joining us today.
Thank you, John. It's really quite an honor to be here and talk about the work that we have been doing in individuals with multiple sclerosis, and much of that work being funded by the National Multiple Sclerosis Society. So thank you for having me here.
Certainly. Changes in cognitive function are common in MS. In fact, more than 65% of the people living with MS may experience problems with cognition at some point during their disease course. Dr. Prakash, can you explain what cognitive function is and which cognitive functions are more likely to be affected by MS?
Sure. So cognition and cognitive function, it's a broad umbrella term, and it includes mental processes that are involved in learning new information. So for example, those of you watching this webinar today are going to be taking in some of information and storing that in your memory. And tomorrow, when someone asks you, what did you do yesterday? You need to remember that you heard an excellent presentation by a professor at Ohio State. So is cognitive functioning. It includes everything from being pay attention, right? So right now, being able to focus in on what I am saying and not being distracted by things that you have to do in the future or things that you did in the past. Being able to respond to things. It involves motor language use, And as humans, one of the things that we are really good at is planning for the future and multitasking. So all of this falls within this broad umbrella term of cognitive functioning. Now, what's impacted in multiple sclerosis? This has been the topic of research studies for, I would say, the better part of a decade now. And cognitive functioning, when I first got started in this field, we had just started cognitive functioning within multiple sclerosis. But now we recognize it's a pervasive and a salient symptom that occurs anywhere between 40 to anywhere in between 40 to 70% of individuals with MS. There are studies that suggest that MS almost has a sweeping impact on all of these different domains that I was mentioning to you, but the most commonly impacted domains that we see in individuals with multiple sclerosis, processing speed, right? So how fast can you respond to certain things? Memory, this ability to learn new information, store it in your brain, and then be able to recall that at a later. And then attention and execution, that's when your planning comes in. That's when your ability to multitask. A lot of us, all of us are this pandemic, and if there are young parents out there like myself, not only are you focusing on your work, but you're also attending to the schools, to doing homeschooling with your children. So that's often multitasking. So that tends to get impacted in people with MS. And the numbers are all over the place. Different studies find different numbers, but I think it's safe to say that anywhere between 40 to 70% of those with multiple sclerosis experience some kind of cognitive impairments.
Do cognitive symptoms occur in relapsing, remitting, and progressive forms of MS?
Yes, they're actually present in both phenotypes of the disease, but they're just more aggressive in the progressive forms. So, when we define cognitive impairment in any clinical population, what we do is we usually compare the scores of our participants with what are called matched healthy controls. And if they score below, called 1.5 standard deviations below the mean, they're considered cognitive. So what that translates to is that if we think that cognition is normally distributed, so when you have individuals that score below the 16th percentile, we say that they are impaired. So for those subtypes of multiple sclerosis, they're twice as more likely to be cognitively impaired, and the magnitude of that cognitive impairment, right, how much cognitive impairment there is present, can be quite severe as well. There was a recent study that was actually published in 2017 in Neuroscience and Biobehavioral Reviews, and this was what we call a meta-analysis. So they aggregate data across different studies. So they looked at 47 different studies that compared progressive types of multiple sclerosis, or individuals with progressive MS, to those with relapsing remitting multiple sclerosis. And what they found was that the progressive types had higher overall cognitive impairment. And then for each of the 12 cognitive that they included, there was much more impairment in primary progressive multiple sclerosis. And now this effect was independent of fatigue and depression scores. So yes, it's present in both forms, but just much more aggressive in the progressive forms.
And can cognitive impairment occur or develop at any point in the disease course?
Can you say that question one more time?
Certainly, I was asking whether cognitive impairment can occur or develop at any point in the disease course.
Yeah, I think that it can indeed develop at any point in the disease course, and there is some, mixed evidence when it comes to associations between disease duration and functioning. There are some that find that there is a positive correlation. So if you've had the disease for longer, then your cognitive functioning is worse. But there are other studies that don't find evidence for that. But there is, it really can happen at any point in the disease course.
So as these symptoms can develop at any point, what are some of the signs of cognitive dysfunction in someone living with MS?
I think that's a really interesting question. And one of the things that I think about science, so the way cognitive symptoms show up in individuals with multiple sclerosis is it's a pretty heterogeneous presentation, right? When I was saying that MS has a sweeping impact, for some, it may be that they have problems with memory. They're not being able to retain as much information. For others, it may be just being not able to pay attention. And we are just beginning to look at cognitive phenotypes in multiple sclerosis. And so this actually depend upon the person's baseline level of functioning. So I always say, our patients and our clients are really the experts of their own symptoms. They know what they were able to do last year or before they had their diagnosis of multiple sclerosis. So if they notice a shift and a dramatic shift in their cognitive functioning, that's when they need to go to healthcare providers and engage in those conversations. So for example, I'll give you my own example. My job and my training is all about reading literature and reading different papers, so I can quickly draw from be able to tell that to you, but that's not everyone else's job, and people don't do that. So if I was to test you on that, of course you're not going to do well. So I think everyone needs to be aware of their baseline symptoms, and for some it may be I'm not being able to multitask as I was able to do before, and so I see a dramatic shift in that. For others, it may be I cannot remember different things. So I'm planning multiple events, but I mix up of all of those events, whereas before I'm an event I used to be able to do that at all times. So I think it really depends upon where the individual is in terms of their baseline functioning.
Mark wrote in saying that he has a problem with his memory, and he's wondering if that means that other cognitive functions might eventually be impacted too. Is that likely to happen?
So I think that's a really interesting question. As I said, beginning to look at different cognitive phenotypes of multiple sclerosis. In the we have done is we've simply differentiated people into impaired versus cognitively preserved. There was a recent study that was published in, I think, 2020. This was a large-scale, multi-center study in Italy where they collected in over 1,200 individuals with multiple sclerosis, and they gave them a battery of cognitive tests. And what they found was that you can identify these 4 different cognitive phenotypes or cognitive subgroups almost of MS patients. And these included those who were cognitively preserved, so they did not experience any cognitive impairment, those with mild memory decline, so they only had memory decline and did not have any other deficit, those with mild multi-domain symptoms, so they had memory decline, but then they also had declines in processing speed and working memory. The third one was severe executive function and attention dysfunction. And then the fourth one was severe multi-domain cognitive functioning decline. So now if Mark is one of those individuals who's in the mild memory decline group, then he may experience problems with memory, but possibly may have no other impact on. But if he's more in the mild multi-domain symptoms, then it's likely that, if he's had decline in memory, he may also start having decline in processing speed and working memory. And that's why I think it's important to continue monitoring these symptoms and also being, a healthcare professional, know about any changes in baseline level.
Speaking about monitoring your symptoms, we heard from Patty, who's 76 years old. She's living with MS, and Patty's asking whether the cognitive changes that she's experiencing are from MS or dementia. So how is dementia different from the cognitive changes seen in MS, and how can Patty determine which is which?
So I think that's a really great question, and something that has been on a lot of our minds, not just as researchers, but also as clinicians. So first of all, dementia is a really broad umbrella term, right? It many different kinds of neurodegenerative disorders, like Alzheimer's disease, Huntington's disease, vascular dementia, Parkinson's, Lewy body dementia. But one of the more common ones that we often think about when we think about dementia is Alzheimer's disease. And what we do know is the biggest risk factor for Alzheimer's disease is increasing age, right? 50% of those with who are older have Alzheimer's disease. But in Alzheimer's disease, one of the earliest signs that you see problems with memory retention, or this ability to take in new pieces of information and store it in memory for later use. And it is aggressively impacted in those with Alzheimer's disease. So those who've been diagnosed with this disease, they're unable to remember small details. But as some of our attendees may know, that Alzheimer's disease is a pretty late stage, but there's lots of early prodromal phases of Alzheimer's disease as well. You know, you have mild cognitive impairment, you even have early of the disease, which have been called preclinical Alzheimer's disease. And so it's important to be aware of these stages and perhaps consulting a neurologist if cognitive symptoms tend to be getting worse, or if you start noticing that, you know what, earlier my problems were more due to an inability to focus, or I had motor struggles, but now I'm really and truly struggling with remembering new pieces of information. And going back to our baseline, we all have our different strengths and weaknesses. You know, I always struggle with remembering faces, but I'm really good at. I probably know the phone numbers of some of my friends from high school, but really. So for me, it's important to know that. There have been a handful of studies that have compared cognitive performance in Alzheimer's disease patients and then individuals with MS. And what they report is that Alzheimer's disease patients much aggressive and greater impairment in memory metrics, but then MS patients to some decline in memory also show impairments in attention and processing speed.
So how does someone know when it's time to discuss their cognitive symptoms with their neurologist or MS specialist?
So I think in MS, one of the things that I have found really remarkable is the commitment of both individuals with MS and their healthcare providers to this, that MS has a multi impact. So whenever I have sat in on neurologist evaluations, the healthcare professionals are almost always about struggles with cognition. So at the same time, it's important for our listeners to know that cognition is one of those facets that is so impacted by stress, right? We all know a little bit about living with stress right now. It's impacted by your current mood status. So if you are going through an episode, you are experiencing symptoms of depression and anxiety, or you're not sleeping well, so sleep patterns impacts cognition, your exercise patterns impact cognition. So knowing when there's a dramatic shift in any of these lifestyle habits or any of your stress responses, it's important to mention that to your health provider as well. So not just talking about the changes in cognition, but all of these various contextual factors so they can prescribe the right kind of treatment.
And does assessing cognitive function early in the disease course make a difference?
I think so. I think, the treatment of multiple sclerosis is just so multifactorial, and it needs to be integrative so that we're not just addressing the symptoms that people are experiencing, but also the cognitive as mental health symptoms that people are experiencing. Assessment of all of these domains can really help develop an integrative treatment plan and also acknowledges the interplay of all of these factors. We know that when we are feeling depressed or when we're feeling anxious, our health overall doesn't really well. So I think assessment of all of these domains is certainly helpful early on in the disease course.
I know that your research focuses, or some of your research, I should say, focuses on understanding neuroplasticity in the context of aging and MS. Can you tell us what neuroplasticity is?
Sure. As a director of the Brain Imaging Center, that's certainly my bread and butter. I do that a lot. So neuroplasticity is simply our brain's ability to reorganize, change, adapt functionally and structurally in response to growth. So as we our lifespan, the various experiences that we have, and disease and illness. So how the connections of our nodes of our brain regions change to all of these different things is what we refer to as neuroplasticity.
And are there ways to enhance or improve someone's neuroplasticity?
Absolutely. In fact, the thing about the brain is almost everything that you're doing is having an in the brain, right? So, for example, listening in on these conversations, we call them cognitively stimulating activities. So you're constantly challenging yourself to learn new pieces of information. How different research is impacting your brain. So all of that can enhance neuroplasticity. We're going to talk a lot about exercise, meditation, and that impacts neuroplasticity. And one of the pieces, we're not going to talk about this today, but I think the strongest evidence is also social support, right? And that's why the work that the National MS Society does in terms of providing social support networks, those with multiple sclerosis, is really impactful, because we know that social support can also enhance neuroplasticity.
Well, before we continue our discussion, I'd like to take a moment to welcome those of you who have continued to join us. Please let us know what's on your mind. Type your questions into the question or chat box in GoToWebinar, and we'll address as many of those questions as we can during the Q&A portion of today's program. And MS Navigators are online throughout today's program, answering your questions and connecting you to the best resources. Our Ask an MS Expert program takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family, your friends, and on all your social channels. Evidence shows us that modifiable lifestyle factors like diet, exercise, and emotional well-being all have an impact when it comes to preserving healthy cognition. Dr. Prakash, what are some of the first steps people living with MS can take to improve their cognitive function by modifying some of those lifestyle factors?
So I think the first steps that they can take, John, is to listen to this webinar. There's a lot that we're talking about in terms of lifestyle factors. So I think acknowledging that lifestyle factors can and are being shown to improve cognitive functioning is certainly a first step, but then also recognizing that there are multiple pathways to cognitive health and neuroplasticity, and going to be able to stick with. So this is I'm putting on my clinician hat, because sometimes we have clients and participants forcing themselves to engage in a certain lifestyle changes, like let's say mindfulness meditation. After doing this for a decade, I can tell you it's not for everyone. It's certainly not all in the end all, but it's a pathway to cognitive health. And if it doesn't work for you, that's okay. And there are multiple other pathways that you can take, exercise being another. So I think first acknowledging and knowing, what works for you, and then what you can stick with and incorporate in. That's why I like to call them these lifestyle factors, because you have to incorporate them, and the way that they work, start incorporating them in your everyday life and seeing if you can stick with those.
Well, just a moment ago, you talked a little bit about exercise. So let's circle back to that, because we know that exercise impacts almost every system within the human body. And there's current evidence that shows that it's beneficial for all people living with MS, regardless of their ability level. How might exercise impact cognitive function in someone living with MS?
So I think, one of the things to do first, and this is going to be a long-winded answer, but just to give you a bit of a representation of what what this field looks like. So, within, I think the last decade or so, over 275 studies have been published looking at exercise and how that impacts MS. So it's a very big literature. And I think in this literature, what we need to do is we need to make a distinction between what's called exercise, which is planned and structured activities that we are engaging in with the intention of enhancing or even maintaining our levels of physical fitness, right? So this is when you're saying, okay, I'm going to go on a brisk walk so that I can improve my levels of physical fitness. Or pre-pandemic, if you had exercise classes that you had planned. And so those are done with the intention of enhancing your physical fitness. So physical activity, on the other hand, so that is a much more broad umbrella term, encapsulates exercise under it. It's any movement that you make that results in an increase in exercise, in energy. So if I'm sitting right now and then I have a standing desk and I stand up and then just start walking a little bit while I'm doing this webinar, increase in physical activity. So if you go to the grocery store and you buy your groceries, you're engaging in physical activity. So studies have looked at both how exercise impacts cognition as well as how even small, simple changes in physical activity can impact cognition. And then physical fitness, right? That's what we're trying to enhance as well. So that is an attribute of us, or it's the capacity that we have to perform these physical activities and exercise. So when it comes to exercise training in MS, this literature is just vast. As I said, we have 205 studies that have been done, and studies are different in lots of ways. So you can have studies that has one group engage in exercise training and another group, let's say, engage in book reading. So they compare those two. Or you could have studies that do one type of exercise. So the most common ones are what is called comparing aerobic exercise. So this is when you're engaging in exercises that really require a dramatic increase in oxygen consumption, to more of your stretching and toning exercise that require short bursts of energy. So different studies have been done, and across these studies, there's evidence that exercise training in multiple sclerosis can really help improve physical fitness. So that's great. So our higher, it improves our capacity to engage in physical activity. It can improve what is called fatigue, which I'm sure a lot of you are familiar with, and then also depression and balance. So those are really important metrics, and the effect is between small to moderate, but it's pretty consistent. When it comes to cognition, which is the question that John answered, I think the evidence is still mixed out there. We have studies that have found that exercise training improves what is called processing speed and working memory. But then we've also had studies that have found no evidence of exercise training, especially when you compare it to what's called the stretching and toning group, and for that to improve cognitive functioning. And I think, what we really need in the future and in the near future are these well-powered studies that include hundreds of participants and really look at, is it more, does it have more of an impact in relapsing remitting MS or cognitive or primary progressive MS? How does disease duration moderate these results? How does baseline levels of cognitive moderate these results? So there's still to know, but I think there's some promising evidence that exercise training can impact processing speed and working memory in individuals with MS. John, I can't hear you.
That's strange. Can you hear me now?
I can hear you now, yes.
Oh, good. Okay. Well, a little blip that happens from time to time, I guess. At any rate, I was saying, if someone just heard what you had to say and decides to commit themselves to making an improvement in their overall cognitive functioning and in some of those symptoms you mentioned, how much exercise is necessary before someone sees a lasting change?
So I think that's a really good question. And I think for those people listening in here, the first thing I would recommend attending to is your baseline level, right? So if there are people in here who already are walking 10,000 steps, or who are already engaging in moderate intensity exercise 1 or 2 days a week, then there are a certain set of guidelines for those individuals. But if you find yourself, especially, and many of us find ourselves in that situation where because of the pandemic, because of work from home, because of our regular schedules being disrupted, our step count has even gone down. Like it's no longer at 10,000, it is at 3,000 to 4,000. So we need to see a gradual increase in our exercise changes. But there are evidence-based consensus guidelines that have been created for individuals with MS. And these include that people with MS should undertake at least 2 to 3 days per week exercise. So this includes about 10 to 30 minutes of moderate intensity exercise and about 2 to 3 days of resistance training targeting different muscle groups. Now, you know, like I said, it's really important when people hear these numbers, and I'm a clinician, so I know how it ends up working, is we just give up and we're like, no, that's too much, I cannot engage in that. So I think acknowledge what your baseline levels are, and that's okay. And I slowly but steadily, that could be your eventual goal. I can tell there yet, especially with all of my reduced. Slowly start to improve your physical activity levels and start with low intensity exercises. And these can include, you know, when you go to the grocery store, rather than trying to find the first parking spot, maybe park towards the very end and start walking and take a few extra laps at the grocery store. So slowly but steadily work towards that goal, and find a group of people who you can do this with. I just cannot emphasize more the importance of social support within, especially when you know, especially during this time as well, and I think in general as well. So see if you can do this with someone who could also be an accountability person.
MS is a progressive disease. Some people living with MS may feel that they have to stop exercising because their exercise or physical activity routine becomes more challenging, unsafe, or simply unenjoyable. What are your recommendations for adapting to these kinds of changes?
Yeah, I think that's definitely something there is some evidence that exercise training can reduce the rate of relapse by about 25%. I always say research and, you know, having these findings can have powerful impact in just getting started and having our mindsets. I think exercise training is known to reduce relapse rate. It's also known to impact the different symptoms of multiple sclerosis. And I think if you find yourself, again, finding exercise to be challenging or unenjoyable, that's why setting goals that are actually manageable and setting what are called SMART goals, so that you are slowly, incrementally increasing them and doing this with another person. I really cannot emphasize, when I'll talk about some of our mindfulness research, I'll tell you about the importance of social. But finding an MS buddy who, again, is in a similar boat as you, who's having the same struggles as you, can go a long way in terms of increasing levels of physical activity. And we don't all have to get on the Peloton and do those insane exercises, right? So we could all start by just finding a buddy with our masks on and going out on a walk. And with the weather at least clearing up where I am in Ohio, that's definitely more doable. So I think starting small and setting achievable goals for yourself, but really committing to it, because we know that these lifestyle behaviors are having an impact. Even if the evidence on cognition is mixed, there's a whole host of evidence that supports the use of exercise for improving overall levels of health, for reducing depression, for improving balance, and increasing your fitness levels. So just by sheer virtue of that, I think committing to something like this can go a long way.
Your research also focuses on studying the association between mindfulness and cognitive functioning. Can you tell us what is mindfulness, and how does mindfulness meditation differ from other meditation practices?
Absolutely. I can talk about mindfulness all day. So mindfulness, you know, just like I was physical fitness. So mindfulness is an attribute. It's our capacity to be able to attend to what's going on in the present moment, and doing so with attitudes of acceptance and non-judgment, right? So if you are in this moment and you've committed to watching this webinar, just really being present for it. And we know distractions of all sorts arise, right? We know that we have right after this, we have things that were going on right before this, and our mind can be in different directions. But it's our intention to being in the present moment. I do a lot of work with clients who suffer from depression and anxiety, and sometimes attending to the present moment is not pleasant, or it's really challenging. And so the other component of mindfulness really is this idea of doing so with acceptance and non-judgment. So we provide training in mindfulness meditation. We talk about a number of different attitudinal qualities and that form the backbone. And these attitudinal qualities include things like not judging ourselves constantly, not striving, trusting ourselves, having patience, and just letting go of this desire to be in control at all times. So mindfulness meditation, the way it got popular here in the Western world is through this program that was developed by Jon Kabat-Zinn called the Mindfulness-Based Stress Reduction Program. This is an evidence-based manualized intervention that goes over, that is about an 8-week-long period where you engage in very specific set of practices that build upon one another. So I have a mindfulness clinic at the Department of Psychology at Ohio State University, where I provide training to doctoral students in clinical psychology who run community clinics on mindfulness-based stress reduction. And there are lots of different meditation, but in mindfulness meditation, we have 2 different types of practices that we tend to focus on. One of them is called focused attention. So, many of you may have heard about what's called the breath awareness practice. So, you close your eyes and you start by attending to the in-breath and the out-breath. Now, anyone who has tried how hard that can be, and that's totally, the first time I did that, somebody rang a bell and they were like, focus on your breath. I was like, how hard could it be? I have a PhD, it turns out very hard. And they rang the bell after 15 minutes and I was off thinking of an entire study that I had to plan. So it can be challenging to engage in that. So those are your focused attention practices. And we move on to some more, I would say, multifaceted practices of open monitoring. So, but I don't need to necessarily go into those right now.
So tell me, what have you learned from your research about mindfulness and cognition in MS?
So, this research, unlike the exercise training research in multiple sclerosis, is still in its infancy. There are only a handful of studies, including our own work, that have looked at how mindfulness meditation can impact cognitive functioning in multiple sclerosis. So our study, this was a pilot study, so we call this a stage. And what we did, compared people who engaged in mindfulness, who did cognitive training, and then we had a third group of waitlisted participants, and we gave them a battery of tasks, including processing speed, working memory, episodic memory, and other domains. And what we found, actually to quite our surprise, was that mindfulness training outperformed both cognitive training and, of course, the waitlist group. That wasn't the surprise, but outperformed cognitive training in terms of improving processing speed measures. So that's pretty remarkable, given that processing speed is one of the first cognitive domains to be impacted in multiple sclerosis, and the one that you see a large number of participants. And so for mindfulness training to impact processing speed over and above this cognitive training group was pretty remarkable. What we also found was that working memory, it's another domain that's impacted in MS, showed improvements in all 3 groups. So we don't know if that effect was attributable to the training that people were receiving, or just the fact that people were doing the tests multiple times and so they showed improvements. But yeah, so I think this research is still in its infancy, and I hope that in the future I get to do some more large-scale trials of mindfulness with individuals with MS.
Can you share some mindfulness techniques that people living with MS can practice in their daily lives?
Absolutely. So one of the things I did when the pandemic started last year, because I had been working on developing these materials, and some of this work is also funded by the National Multiple Sclerosis. And I always planned on releasing these materials or evidence, but with the stress that everyone was experiencing, I launched a YouTube channel, and basically all of our meditative practices are explanations of mindfulness and what mindfulness means. What does it mean to the breath? What are the different attitudinal foundations? All of these materials are available free of cost. I didn't sign up for any of that, on a free YouTube channel that anyone can access. And please get started with some of these practices. And then there are, from there, usually people are able to branch off into different directions. And they're like, you know what, I really like this, and I'm going to try and find more of kind of exercises. So I would say that's a really good starting point.
Well, we've heard from Kristen, who said she's been trying to meditate, but it's very hard for Kristen to keep her mind focused. Dr. Prakash, what are your recommendations for helping Kristen be able to focus during her meditation sessions?
So first of all, Kristen, know that you're not alone. Lots of people think that mindfulness is all about getting rid of thoughts. Like, once I engage in mindfulness practice, I will not have any distracting thoughts. I can tell you, I started engaging in mindfulness meditation practices in 2007, and since then have been continuously engaging in those and have a pretty solid meditative practice. But that doesn't mean that thoughts have gone away. That doesn't mean distractions have gone away. All that it means is that's a natural part of who we are. In fact, there's research suggests that about 50% of our waking time is spent in mind wandering, and mind wandering can be good for us. But what mindfulness allows us to do is that it gives us the choice, right? It gives us the choice to be aware of where our distractions are. Our mind is, and you can choose to engage in those distractions. Often the invitation is to see if you can let go and then come back to attending to the present moment. But it can be really hard, and that's why I often encourage, and especially now, I often encourage people who are really interested in something like this to normal and mindfulness-based stress reduction program. It's an 8-week program and makes the commitment to actually engage in those practices. You need a community. That's where, again, the social support element comes in. So you need a community of people, as well as facilitators, who can help guide you through this process, who can talk about how do you work with distractions, how do you let that go and then come back to what's going on in the present moment. And once you find, I run groups of 10 to 12 people. I can tell you, I haven't had a single group of mindfulness reduction where there was one client who was like, I don't face distractions. Nope. Almost every single individual experiences distraction and mind wandering, and that's okay.
Laura asked, how many days a week and for how long does she need to practice mindfulness meditation?
Every day that you practice is one day more than you did not practice. So whenever you're able to, and I think people have stress on themselves about, if I have an hour every single day, only then can I commit to. So in our studies, what we invite participants, an invitation, because we know everyone's lives are different, but the invitation is to engage in practices 30 minutes for 5 days a week. Now, for some, 30 minutes is not a big deal. They're like, yes, I have that time. I can definitely do it. But every practice that we give to our clients, or that's on the YouTube channel, there's a 30-minute version and there's a 15-minute version. Sometimes find yourselves with 30 minutes in a day, or you can carve out 30 minutes to do these exercises. But 15 minutes, that sounds more doable. So for 15 minutes, you can say, okay, you know what? I'm going to shut off my email. I'm going to start this practice and just take 15 minutes for myself to engage in this breath awareness practice. So that's a good start. And then you can be right there at 15 minutes, or you could work it up to 30 minutes. So I think, and like I said, one day is, if you decide to even just do it for one day a week, that's one day more than what you have done otherwise. So start there.
Paul wants to know if mindfulness meditation is a practice that he'll get the most out of by pursuing it independently, or will he get more out of it by joining a group?
I do think that, this isn't based on any research evidence, but mostly out of running mindfulness groups in the community, better part of a decade now, is that community is a really important pillar of mindfulness practices. Lots of people, when they start with it, it can be really challenging, and especially it's not just about, oh, I'm not being able to focus, but a lot of mindfulness people think, oh, it's relaxing, but working with negative emotions, or for those of you who are in pain and in constant pain, working with those sensations of pains is not a pleasant experience at all. And you need that community, and you need those facilitators with years of training to help you guide through that process. I do think that after 8 weeks are over, you can do more independently, but I think joining a community and joining a group that leads you through this evidence-based program is a really good starting place.
And it sounds like, from what you've already shared with us, that pursuing some of these virtual mindfulness meditation sessions, the ones that you posted on YouTube, for instance, can make a lot of sense. A good way to get started, especially given the limitations of the pandemic.
Absolutely. And not when we posted things on the YouTube channel, those are mostly recorded videos, but there are also live sessions that are happening, just like, this webinar here. So if you find yourself wanting like more one-on-one not one-on-one, but like more live interaction, then those are also good sessions to do. All of the mindfulness programs that we're offering in our clinic right now, they're all completely virtual, and we've been able to adapt them from our in-person exercises. And actually, one of the things that I think the research community is recognizing is the accessibility of a lot of our training programs, as well as a lot of the work that we're doing when we're offering it through Zoom or through these online platforms. And I think in this last year, we've all taken a really good look at our programs and seeing, what we can offer these virtually. For the longest time, we were like, no, you need to be in person. You need to come and navigate the 40 graduates that are running around Ohio and come to our campus, and only then we can provide you the training. But now we've had so many of our participants say, you know what, I would not have done this if it wasn't online. And I think that's definitely given us pause, and going forward in the future, there are certainly changes that we to continue making sure that these are accessible by those who cannot do these in person.
And where can someone find more information about mindfulness meditation?
So I think, really, you Google mindfulness and there's so much that comes out, but then you also have to sort through a lot of that information. So one thing that I have done is, so I have that YouTube channel, but on my lab's website, we also have or I wonder if we took that down, but we have a list of mindfulness resources. So these are the books that I have personally read, benefited a lot. A lot of my training is derived from those books. There are podcasts as mindfulness practices, and I can share that with the National MS Society. If anyone wants to pass that around, you could definitely do that.
Well, you've shared some important and very helpful insights with us today. What would you say are the top 3 takeaways that you'd like our audience to remember?
So I think the first one is that there is an intricate bidirectional link between your emotional health and your cognitive health. Now, be aware of that and work towards improving both aspects of your health. So when people are focused on one piece, and they ignore the other one, it's hard to work on that. So if you are feeling depressed, you're feeling anxious, your cognitive health will be affected as well. So you need to recognize and be aware of this bidirectional link. So that's one important thing. We didn't talk about this too much, but build and actively maintain your social support network now more than ever. So your MS you have, or the MS support group that you go to, or your friends and family who are aware of how MS is your everyday living, that it's important to be able to share with those individuals and count on those individuals. And then the third important takeaway is that there are many, many pathways to human brain health. You don't have all of them. You don't have to stress out about all of them, but pick one for you, one that you can engage in your own lifestyle and just stick with it at least for some time to see the noticeable impact of those interventions or those lifestyle changes on your own health.
Thank you for sharing your expertise with us, Dr. Prakash. We have time to take a few more questions that our audience has for you. Frank asked, are cognitive loss and emotional changes tied together?
Absolutely. That was one of my important takeaways, right? So there is a good amount of evidence that suggests that, and this is all correlational, right? But depression is associated with impaired performance in processing speed, working memory, learning and memory, and you don't know the direction of that. Is it that causes cognitive impairments, or is it that people experience such remarkable cognitive deficits and that leads them to depression? And I think it's safe to say it's a bi-directional relationship. So that's why when you are on your cognitive health, it's important to also acknowledge your emotional health on both of those simultaneously.
Jane asked whether cognitive decline in MS is progressive.
So yes, so I do think that cognitive decline in MS can be progressive. And there's a new body of literature that is looking at aging with multiple sclerosis and how aging can impact the various domains of cognition. And we know that as we get older, our cognitive functions decline, but of age and MS has a much more aggressive impact on cognition. So yes, cognition can certainly be impacted as the disease progresses.
I think you started to answer this question back when we were talking about plasticity, but Amber is asking whether exercise can help the brain to reroute neural pathways that have been damaged or interrupted by MS.
I think the multi-million-dollar question that the National MS Society is trying to answer. So we have some evidence for sure that exercise can change the neural networks and change the connections between the different networks and make the brain more efficient, increase the volume of different structures. So for example, one of the studies that I had published in 2011 was a study where we looked at how exercise impacts the volume of the hippocampus in older adults. This was not a study in individuals with multiple sclerosis. And we found that those who engaged in walking, so just walking 3 days, 12 months, they showed an increase in the volume of this structure that had a very important role in memory formation. And so there's evidence from not necessarily individuals with MS, but other populations that exercise and really have an impact on neuroplasticity. I think there is evidence in MS as well. We've done some cross-sectional studies where we've shown that physical activity that we measure in people, that shows correlations. So this was a correlational study, and it shows correlations with the connections that this hippocampus has with the rest of the brain. So I think we have promising evidence, but I know that the National MS Society has funded quite a few studies that are answering exactly the same question. And hopefully we'll have much more precise answers in the near future.
Mark is asking, what do you recommend if a spouse with MS is in denial of cognitive and behavioral changes that are obvious to other family members?
Yeah, that's a tough question. And I think when working with clients that are in denial, the first step, of course, is for that person to acknowledge some of the changes that are happening, for someone to repeatedly trying to give them the almost always has a counter effect, and it's a counterproductive effect. So that's not something that we want to do. But I also think that therapy goes a long way in these situations, right? So perhaps working, it doesn't have to be behavioral and cognitive changes, but I think having the person be aware and acknowledge is a first step towards any, right? So acknowledging that I am having cognitive difficulties or cognitive challenges, because in lots of times the reasons for denial is often coping related, right? Because that's how they're coping with the changes that they're having. And as a caregiver, and one of our primary responsibilities is to ensure their safety and to also ensure that they are moving towards a pathway in which they're incorporating different lifestyle factors so that they can improve their health. Starting maybe from a place of getting therapy or getting therapeutic help so that individuals can start acknowledging some of these symptoms would be a good start.
Well, I want to thank all of you who submitted your questions, and thank you, Dr. Prakash, for being with us today.
Thank you. It was such an honor to be here and to share all of the work that we have been doing. And a big thank you to participants who they're just so selfless when it comes to their participation in research, and they're so committed to this. So none of this would have happened if we didn't have our members who were doing our research studies. So thank you for that.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you. These are resources that you can count on to be current and credible. To learn more about how a healthy diet, regular exercise, stress management, and other wellness strategies can help you manage your symptoms and feel your best, please visit the MS Society's website at nationalmssociety.org/livingwellwithms. I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. And I'll remind you that the MS Society brings people together through peer connection programs like self-help groups, the MS Friends Helpline and Paired Program, and the National MS Society Facebook community. To learn more, please visit the Society's website at nationalmssociety.org/connections programs. If you have a young person at home who's living with MS, I hope you'll tell them about this new connection opportunity at the MS Society's virtual MS Adventure Camp. MS Adventure Camp offers monthly educational content and the opportunity to connect with other teens between the ages of 13 and 17 who understand the impact of MS. The next program will take place on May 18th at 7 p.m. Eastern Time, and will focus on MS and my family, talking about MS. To register and learn more, please visit nationalmssociety.org/camp. Every week on the Real Talk MS podcast, I continue the conversations that we start here. So I hope you'll take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite audio content. Walk MS 2021 is coming, and this year, Walk MS will meet you where you are to connect, celebrate, and make a difference like never before. For more information, please visit walkms.org. And you can connect with the National MS Society along with others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. I encourage you to like the posts, subscribe to the channels, and make sure that you're on the Society's mailing list so you'll continue to receive the latest information on MS and updates on upcoming programs like this one. I'd like to thank Dr. Ruchika Prakash for joining us today. Please remember that a recording of this webinar will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us For next Friday's edition of Ask an MS Expert, we're going to be talking with MS certified nurse Megan Weigel about living well outside of your MS. You'll learn how physical, emotional, and psychological factors impact your overall health, and you'll find new strategies to support your personal exploration of wellness. Now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. On YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us to continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Ruchika Prakash and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.